are unable to feel that their kids are getting the best education. Today in Congress, as I wrap up, there's a huge trust deficit in Congress on behalf of the American people. We see a lot of bickering, a lot of partisanship, and I've been a bridge builder during my years in the Assembly. I hope to continue to be a bridge builder in Congress to be able to accomplish things. Our working families don't have the luxury of making excuses when they can't make ends meet, and neither should our representatives in Congress. So thank you, and I hope that you will join me in my partnership as I work hard to ensure that every child in America and in Queens can live their American dream as well.
Is there a representative from Dan Howland's office here tonight? Well, I'm sure all of you know that Dan has a medical emergency. He has had some surgery done, which I've been told tonight has been successful, and he will be back on the trail soon. So in September, whoever wins this campaign on the Democratic ticket, they're welcome to come back and challenge Rory. We want this to be an even, playing field, a level playing field. So be prepared. We'd love to have you back. I do have a very quick statement I just want to make, and the reason I'm doing this is because I was asked to, and I don't want to waste your time. But we gather this evening to put forth questions on topics of crucial importance to our erstwhile candidates who are seeking one of the most important positions in the federal government, a seat in the United States House of Representatives, and all that it implies: wisdom, integrity, and the awareness that they are our representatives, our civil servants. It will be their responsibility to put the interests of American citizens above private and foreign interests, and to uphold the United States Constitution. Thus, we will be placing our trust in their hands. May the questions begin.
Good evening. My name is Johnny, and I don't need a microphone. So being that we only have one, I'll break it. Oh, luckily for me.
Sure.
So what we're going to do is, if you feel you need a microphone, we'll put it here, and you can pass it around if you think it's necessary. The goal for this evening is to give everybody an opportunity. So we have questions, and what we plan on doing is we're going to ask one of the candidates the question first, and then each candidate will answer the same question. So there'll be very much a comparison between. And not to put any pressure on any one individual, the first person for a question will move around. Okay? Now, it's not necessary for you to stand up, because you're going to be getting up and down all night, and you want it to move faster. We as a group are nonpartisan. We all have our own political perks. But as a civic association, we are nonpartisan, and this is supposed to be as objective as possible this evening. The organization got together and outlined a couple of questions with priorities, and then we have questions from the audience that we're going to get to. Okay, we would like to make this brief. All right, this is not TV, and we would appreciate no long-windedness. Yes and no is okay. I don't know is okay. And this guy over here, he's the timekeeper, so he's going to let you know when it's time to move on. All right? Basically, if you could do it in a minute, that would be way cool.
1 minute.
But we'll see. We'll take it as it goes. All right? There's no TV cameras. There's no commercials we got to worry about. Okay. So what we're going to do, just very simply, we're going to start with Ms. Crowley and work our way this way for the first question. Healthcare seems to be an issue that these people concern themselves a lot about. So this is the question we'd like to ask all of you, and if you would be so kind, Ms. Crowley could be the first to answer. If the Supreme Court upholds the patient Protection and Affordable Care Act in its present form. As a member of Congress, why would you be in favor of the act, its repeal, or its change? Additionally, please give reasons why you, as a U.S. representative, would be willing to have the same health care benefits that are being directed to all of us, or do you think that all of us should get the same health care benefits that you get? Ms. Crowley.
Okay. You will prefer if I sat down?
Yes, please.
Okay. I support the Health Care Reform Act. I don't support every area of the act. However, I believe that too many people in this country are uninsured. Somewhere over 60 million people. And because of that, preventative care is not happening. And at the end of the day, our hospitals have been overburdened, and too many hospitals have closed down, especially here in Queens County. And there is a crisis people are not talking enough about. There's a health care crisis, and that has to do with a lot of people not having the proper preventative care, and by the time they get to the doctor, it's sometimes too late. I'm willing to, as a member of Congress, take on the same health care insurance that every citizen has or is afforded. I think also looking at my record in the City Council, I've seen that especially as it relates to women's health care providers, there is a real problem happening because of cost. It seems that private practices are closing, and there has to be a better way where the reimbursement rate to doctors needs to be higher, because many doctors are not taking Medicaid and are even starting to think twice about Medicare. We have to make sure that whatever cuts happen in this health care plan, that it's not cutting Medicare. There's supposed to be $500 billion in savings in the Medicare portion of this plan, and that has to be saved in creative ways and cutting fraud and making sure that a prescription drug plan is going to save money. And I also support the plan because it limits the donut hole, it closes the donut hole. So many of our seniors today have to choose between what prescriptions they can afford. And we can't have that as a society. We have to make sure that people are getting the health care that they need. So I support the act. It's not perfect, and there's time for representatives to go to Congress to tweak it, to make it a better act that will, improve health care. And another part of that act that I didn't mention is that prior to this law, insurance companies could turn people away for pre-existing conditions. And that's a benefit of this plan as well. Thank you.
Thank you very much, Ms. Crowley. Evergreen, would you be so kind as to share your thoughts with us?
If elected to Congress, I would immediately give up my health care plan and cast my fate with the people of America. As Ms. Crowley just mentioned, 45, 50, 60 million people in America uninsured. There's people underinsured, there's people paying insurance as if they'll give another rent, another mortgage. So really, there's a chance to reform right now. The bill that Obama is pushing through, I disagree with it, but the Republican on the right disagree with it, but I disagree with it for a different reason. I felt that we didn't go far enough. I believe in a single-payer, universal health care. Yes, some people call it socialized medicine, some people call it the public plan, and it's basically Medicare for all. This is where we get the middle people, the HMO, out of the way. Right now, my personal view right now is corporate greed, profit has taken over many aspects of our life, especially healthcare. The bottom line is profit, and when you're dealing with healthcare, people's illness, profit should not be the main motive. You cannot run a library, you cannot run a hospital, you cannot run a school based on a profit motive. Therefore, there are many countries with the various forms of single-payer healthcare, but basically it's a plan where the government runs all the programs. Right now, I believe the projected cost of Medicare right now, there's only a 3% administrative cost. So we want to take away the greed and also add into this comprehensive plan. As many of you know right now, it's prevention. Maybe it's not about chemo radiation and antibiotic therapy. There are many proven alternative medicine. I would like that included in our comprehensive plan. I would like to have people think about a diet change. So in a sense, I wanna, I feel this is what the people want. We're heading towards a direction where it's the same junk food, it's the same fast food, it's the same way. Well, the discussion's always in that, but maybe, like you said, we leave the box. Leaving the box is having single-payer universal health care. Thank you.
Thank you very much, sir. Assemblyman Lansing, would you give me some time? This would be the next after that.
Sure, thank you. So I mentioned when I gave my introduction, one of the earliest things that I was involved with as a civic leader is I used to chair the community advisory board at Queens Hospital Center. And Queens Hospital Center is a public hospital. We were really a hospital and healthcare facility of last resort for people who did not have health insurance or were underinsured, which is a very, very serious problem in Queens. And our mission was to provide health care to whoever showed up at our door, regardless of their ability to pay, regardless of what insurance that they had. Here in Queens, we have seen the closings of, 4 or 5 hospitals in the last short number of years alone. Just recently, Peninsula Hospital in the Rockaways closed, Mary Immaculate in St. John's closed a few years ago, St. Joseph's closed a few years before that. So the access to health care is a very, very serious problem for those of us in Queens, and it's a very serious problem for those of us across the country. And the Affordable Care Act took care of a number of very, very important problems. Number one, its mechanism provides that every American will have access to health insurance in some way throughout their life. Number two, it solves some specific problems of preventing insurance companies from denying care because of a pre-existing condition, which was mentioned earlier. It prohibits insurance companies from imposing lifetime caps on the amount of health insurance that a person avails himself of. Now, if I were in Congress at the time that the Affordable Care Act was being debated, I would have been a very strong advocate for something called the public option, which would be either Medicaid or Medicare being expanded so that ordinary people could have access to it. In the case of Medicare, people below the age limit, or in the case of Medicaid, people above the minimum income threshold. I don't support a single-payer health care plan which gives the government entire control over a health care system. But the part of the law that provides every American with access to health insurance, that's not something we as the people can back away from. And I'm not optimistic that the Supreme Court is going to allow the Affordable Care Act to stand. I think we need to be prepared for the possibility that the Affordable Care Act will be repealed, and we need to send people to Washington who have an understanding of health care issues, who have a history of being advocates for health care issues. And in this race, I think that that's something I really have to offer. Thank you.
Thank you very much. Ms. Min, would you share your thoughts, please?
Yes, thank you for this question. I too support President Obama's Affordable Health Care Act. Basically, the beauty of coming to America and being an American is the fact that we are able to take care of our society, our young, our old, and our sick. And I do agree that you and I should have the same health insurance plan, and I will support any measure to make that happen. Something that, when people ask me, people on both sides of the aisle, about the Affordable Care Act, I point out 3 real-life examples that, regardless of what side of the aisle you are on, that enables you to understand why this act, or why the basic principles behind this act are so important. One is the young couple who has a child. Through no fault of their own, the child is born sick. Because of this Health Care Act, the insurance company is unable to tell a parent who has a sick child that coverage ceases to exist at some point, and the child won't be taken care of anymore. A second example is when a student graduates from college, and because of this tough economy and this recession that we're coming out of, is unable to find a job. And because of this Affordable Care Act, he or she can now be under part of his parent's coverage and have health insurance coverage until the age of 26. Another is a small business who, for whatever reason, feels that they don't have enough money to be able to provide health insurance for their employees. Because of this Affordable Care Act, the small business will now get a tax credit and will be able to provide coverage for its employees. So I do support it. I think one way, if I can offer, that we hopefully will be able to save money in communities, in healthcare is for universities and hospitals such as North Shore LIJ and Elmhurst, who just has a women's clinic, to establish and to invest in more local community clinics and to provide us support locally. That way, we don't all have to rush to the hospital. If someone has a fever, you don't have to rush to the emergency room. And this is one way that the healthcare system can also save money.
Thank you very much. Dr. Bitterman, you came in a little late. Basically, we're asking questions. Everybody gives an answer to the same question. The question that's currently on the table is regarding health care. So what we've been talking about for the last few minutes is this question. If the Supreme Court upholds the Patient Protection and Affordable Care Act in its present form, as a member of Congress, why would you be in favor of the act, or its repeal or change? Additionally, please give reasons why you, as a U.S. representative, would be willing to have the same health care act as the rest of us, or why all Americans should have the same health care as members of Congress currently have. Thank you, sir. You're up.
Do you mind explaining me 3 minutes?
I already did.
Okay, thanks.
I said it to him quietly in his ear.
Okay.
Thank you very much. Once again, my name is Robert Minton. I happen to be a family physician and immunologist. Practiced in Bayside, Queens for more than 20 years. Long time. Grew up in Bayside. Now, concerning this issue, I am against the current healthcare position. I think it's wrong, and probably it's one of the main focuses of why I've decided to run. It's very much wrong. People don't understand what's really going on. Basically, everything is going to end up, even the Health Care Act, is going to end up.
Before you sit
Sit
down.
down, okay, sit down. Basically, I want to see the people in the back, but that's okay. I know how I am. My eyesight is not that great, so I feel bad for those that are in the back. The bottom line is, even if you take health care, everything goes back to the budget. We have to balance the budget. That's A. Now, you can't afford the current act the way it is. It's far-reaching. It affects everything. It affects the physician. It affects the patient. They're going to be cutting Medicare, which people don't realize. People who are members of unions. It's the most anti-union legislation there is. People say, what, are you crazy? I've had discussions with union leaders about this. And I said to them, do you realize what you're supporting here? You fought, you got benefits. Benefits is usually, if you look at every strike that we've had, the bottom line, what they always tell us, wasn't the salary, it was the benefits. Now look at it. What happened? You've worked your whole life. You work for a union, Irons Union, whatever union it is, and they give you health care as one of the benefits. From now on, at the end of the year, you're going to get, as part of your salary, whatever it is, it's going to be added on the cost of that health care. Number two, it involves loosening the trust. We should deregulate. There's a lot of answers to the head of healthcare problem. Just to sum it up, because I've got less than a minute, I don't think, outside of our country, this is not Luxembourg. You have a tremendous healthcare system, probably the largest in the world. You can't chop it down and start from scratch. You first have to take the 80% that are covered, and you can even model it after New York. New York has the best health care in the whole United States, the program. We cover children. We cover even teenagers. We cover into the 20s. We need improvement? Absolutely. Absolutely. But more importantly, take the 10 most common problems, let's say people with pre-existing illnesses, make it mandated that you can't penalize them. Make it like a assigned risk where they have to go in. The insurance companies, if you want to sell insurance in New York, you've got to be in an assigned risk, cover these people. I'm sorry, I have a lot more to say about it.
That's okay, we got a lot more time. But I think what we'll do